it completely changed my practice once I started including functional testing. It just let me work with those clients who were really difficult cases. So for some clients, kind of like what you mentioned about changing the diet, that's enough. And that's amazing. If you're in that situation where you need to get your insulin lower, so you need to work on blood sugar regulation, you need to clean up the dairy or whatever else it might be, that's great. But I work with a lot of clients who are doing all the things. They've tried the elimination diets. They've tried all the lifestyle changes, or so they think, and they're still not getting better. So that's where I find functional testing is so helpful. So we're not shooting in the dark anymore. We're actually testing, we're not guessing. Let's figure out, rather than doing elimination diets, which you have to be really strict. So the way elimination diets works is you typically cut out all these food groups that are very likely to cause inflammation. For example, it might be dairy, gluten. For some people, it might be grains. It could be nuts and seeds. It could be nightshades, all these different foods. So first of all, your diet becomes very restrictive, which is very difficult for a lot of people, especially if you have any type of eating disorder history. It takes a long time. So you have to be really good about eliminating for anywhere from 4 weeks to 3 months, depending on what you're trying to do, and then slowly reintroducing foods. That requires so much commitment, so much organization. You have to be so in tune with your body when you reintroduce something like, let's say, dairy. You know, are you able to sense that you're tired? Are you able to sense that you have more joint pain? People are so out of tune with their body, so it becomes really difficult. That's why I really like food sensitivity testing. It just eliminates that need to take so much time and be so in tune with your body. And it tells you answers so that you can just see right away what foods should be the ones to be eliminated. Now, any test is not a 100% golden test that will give you everything accurately. So you always have to look at the clinical history, you have to look at the client's symptoms, and then also taking the test as a different tool in your toolkit to see how does that all play in to make sure that we can give them the best diet to follow. So I love food sensitivity testing for that aspect.
So just to ask a question on that, do you do blood testing?
Yes. So the testing I use is called MRT, mediator release testing. You're familiar?
Yeah.
Great. Yes. So I like that one. It's a little, I like IgG testing as well. I think there's a place for it, but I like MRT a little bit better because it gives you less false positives. Just because the way IgG is tested, that's an antibody test. And part of our normal way of eating food, antibodies are always created. So when you eat a food, that protein, that antigen attaches to the antibody and it forms that complex, and then the immune system is able to remove it from the body. So anytime we eat a food, it is a foreign object, so your immune system reacts no matter what it is. But in a normal immune system, it'll just clear it out. The problem is when the immune system's overloaded, you might have leaky gut. And then once you start eating these foods, the immune system's overloaded and the normal housekeeping process isn't happening. And then those complexes, that protein attached to the antibody, attaches to our tissues. And when it attaches to the tissues, what happens is mediators are released. So that would be like cytokines or histamines or prostaglandins. So these are things that maybe you're familiar with, or the audience listening. So these are what actually causes the food reactions. So that's what we want to test. Antibodies are one thing, but they're not necessarily a bad thing if the body's able to clear it. What we're really concerned about are those mediators. So that's why I like the mediator release testing, because really we're getting to the heart of what is causing your food sensitivities. So that's the one I like to use.
Yeah, I did used to use that some years ago. Well, I won't go into the long story why I don't use it anymore, but I use a very similar test now anyway. It tests pretty much exactly the same thing that the MRT tests for. So that's really good. What kind of other tests do you do for people with acne generally?
And then the other one I like to run is stool testing. So I like to run the GI map stool test. So it's PCR testing. So it's looking at the genetic material of what's found in the stool. And that one is really good because it's very sensitive. You know, some people will say that's a bad thing about it, and they'll criticize how sensitive it is, because I often have, for example, a really common thing that I see with acne clients is an H. pylori overgrowth. But they'll come to me and they'll have, for example, heartburn, acid reflux, indigestion. So these are very common symptoms of heartburn, of H. pylori. They've gone to their doctor, their conventional doctor, they've run an H. pylori test, and it comes up as negative. And that's because these conventional tests, they're really looking for levels often that are a disease state. They're not looking for a little bit of something, so they're just less sensitive in how they do the testing. And then they come to me and run the GI map, which is much more sensitive, and we do find H. pylori. So it's confusing because they think, well, I got this one test that said I don't have any, and this test says I do, but then we work on an eradication protocol for the H. pylori, their digestive symptoms go away, and their acne clears. So clearly, these tests are very valuable in that sense that they are sensitive, and they're testing so many things. H. pylori is just one of them. They're testing yeast. Candida is one thing that it's able to test. It's not the best test for testing yeast, but it is one tool. It's testing your microbiome health. So how are your good bacteria? How are your dysbiotic bad bacteria doing? It's looking for parasites, which a lot of times people will think, oh, I don't travel to foreign countries. I live in the Western world. I don't have parasites. That's not at all true. You can get parasites from anything. If you eat a lot of raw fish, or it could just been one time you ate meat that was undercooked. It's so easy to get parasites. So parasites are often a common thing I see with my acne clients.
Yeah, again, I use stool testing as well. Sometimes I use the GI map, sometimes I don't. It depends on kind of the case of the individual client. Something that I'm quite interested to hear from you is if you see any particular patterns of what you find in stool test results from clients that have acne.
Definitely. So like I mentioned, H. pylori, that's a common one. I also see a lot of yeast candida overgrowth. Like I mentioned, that one's hard to find in a stool test. So that's one situation where we might base it off of symptoms. So we do quick candida questionnaires, figuring out if they have a lot of that health history that aligns with having a candida overgrowth, especially if they have those very obvious symptoms of like a white coated tongue, for women a lot of yeast infections, or fungal things like in the nails, a lot of sugar cravings. All those are very much signs of there's probably a yeast overgrowth. So that might be just a clinical decision of what we want to do. And then the third would be parasites. And I often see Blastocystis hominis come up on the GI map for my acne clients. And other than those three imbalances, which are more so overgrowths, I also see a high beta-glucuronidase, which means that your detoxification isn't working as well. And that's very much related to estrogen clearance not working as well as it should be, which could be a component of the hormonal acne. So when women say, well, I don't think it's gut related, I think it's hormonal because it flares around my period. Even though you say that, hormones are related to the gut because the gut has to clear excess hormones. Yeah. So it's not, hormones aren't the root cause. The root cause is the gut not being able to clear the hormones, and it's surfacing as what appears to be a hormonal imbalance.
Yeah, it's interesting. Again, I was chatting to someone online who was trying to tell me that because she had a hormone imbalance, the only option was medication. And I was trying really hard to, again, in that short period of time I had to write comments on social media. She was just completely blind to the fact that there was another alternative to a hormone imbalance than pharmaceuticals. I think, the other thing she said was, hormones are genetic. I don't know who's told her that.
Yeah, I hear that a lot. People, especially women with really horrible cramps or PMS symptoms, and they'll say, well, my mom had that too, so it's genetic. There's a very small genetic component in most things. So much of it is lifestyle, and you likely grew up with similar habits, let's say, as your mom, and you live in a similar household. You maybe eat a similar diet. So it's so much more than that, than just blaming it on genetics and then thinking, oh yeah, let me just pop a pill because that's the only option.
Do you ever run any other types of tests for women with acne?
I do hormonal testing, but very rarely. I find that once we work on the gut, even though the women wanted hormonal testing to begin with, I tell them, let's start with the gut, let's figure all that out, and then if there's still hormone imbalances, we'll do some hormone testing, and almost always it all clears up, and they're kind of amazed. Their cycles become regular, their PMS goes away, their flow becomes much lighter. So rarely do I run hormonal testing, but that is an option if we come to the point where it might be necessary. Yeah.
I mean, oftentimes, the gut's upstream, isn't it? So if you fix the gut, you're certainly going to help with the hormones to a degree. Obviously, there's lots of other things you can do in terms of the times you go to bed, exercise, and things like that as well. Obviously, what you eat affects your hormones. Again, I think a lot of people don't kind of make that connection, but certain foods can stimulate certain hormones.
Yeah.
What kind of, when you run a hormone test, what kind of test do you use? I
like to use for cycling women. It's called the EFHP test, just a saliva test.
Okay.
Yeah. So, and that one I like because you take it multiple times during your cycle. So it gives you a really good visual of where all your hormones are, especially where your progesterone is, because I see a lot of low progesterone in women with acne. So the Dutch is also one that's a urine test. Yeah. That one I don't like as much just because you're not getting as many sample sizes. So those are the two that would be an option.